Hey guys, so this is the day after my cast removal. I'm really sorry I couldn't do a video yesterday because I was half an hour late to my appointment because of the traffic, and then it took about 4.5 hours to get back, so I couldn't do one as it was very late. So as you can see, my cast is off, my stitches are out, and I'm feeling good about it. My experience yesterday was it was a bit painful, I'm not gonna lie. I'm very sensitive. Even the most smallest blood test would affect me, so firstly I went in and I spoke to Dr. De Silva, and he just asked me how my recovery was going and how I was feeling. I just felt really excited to take the cast off, so he explained that he was going to take the cast off. Unfortunately, my cast was very, very tight, so it caused me a lot of discomfort. He did say that most patients' casts do come off quite easily, but mine was just, I don't know, extra secure, so it did feel like my entire nose was being ripped off, and it was quite painful, and the tip on the top and the tip here as well. So that took about 10 minutes to take off because it was so sticky. And then he went to take the stitches out. I'm not going to lie about that, that was also very painful, only because I think I'm just very sensitive and my pain threshold is very low. But even though that was a bit painful, it was quite quick. It just felt like he was sort of cutting it and then pulling it, and he only did that twice, I think once on this side and once on this side. So that was okay, it made my eyes water, but Dr. De Silva's very good, he was very gentle, and he stopped when I needed him to stop. But once it's off, you feel so, I just felt so free, and I felt like I've, got my face back, really. My first reactions when he showed me my new nose in the mirror, I was happy. I mean, to see that I didn't have my bump anymore, which is the thing that bothered me the most, that really made me happy. I know that this is not really so much of the final result, because Dr. De Silva did explain that I do have a lot of swelling on my tip still, and my face mid-center feels very numb. So he then said that there's going to be a little bit of a medication that he's going to put up my nose, and then I asked what it was, and he said it's actually a little injection. So after all of that, I had I think 3 or 4 injections. I was such a baby, but bless him, he was very gentle with that. So I think he put 1 here and 2 here. Yesterday my family members were saying that it looks very swollen, and I think I got a bit of a hurtful comment from one of my family members, so that sort of made me a little bit insecure, but I know that the swelling is still quite a lot, and I think once you do decide to have a rhinoplasty, I think it's best for yourself to accept that it does take a good 6 to 12 months for it to completely heal and to feel yourself again. And I think maybe I wasn't that prepared for it, but I don't regret going for it. That it wouldn't have changed my decision at all. So injections weren't too bad, very quick, just I couldn't feel it on the tip at all, but I felt it a lot here, but tip was still very numb. Another thing that I forgot to mention in my video, because I just thought it was a normal process, and maybe it is that I can't smile. So if I show you, I smile, but I can't see any of my teeth or any of my gums, which I used to be able to before. Before I thought that this is just because the cast was on my nose, but when I started looking further into it, it says sometimes that the surgery can affect your smile, and where the lip hangs a lot lower and like doesn't show your teeth, because there's certain nerves that have been cut that affect it. I think last night it was quite an emotional night for me because of the hurtful comment that I got from one of my family members, and then to know that it's affecting my smile and I can't have that much of an expression. I was a bit worried as to whether this is going to permanently affect it or not. So I couldn't sleep all night last night. So this morning I actually phoned Dr. De Silva twice, and then he got back to me within half an hour straight away, and he just reassured me that this is sometimes like this does happen, and the smile does come back. It's just generally because of the swelling in my nose, and obviously the numbness. It doesn't pick up the nerves to smile, but over time and over the next 6 weeks it should come back. So I'm just waiting for that. As all in all, with my nose itself, I'm not upset about it. I'm happy with the result, and I know that it will only just get better. So I would like to show you firstly one of the photos of me, well, my nose before, and then I'll show you my side profile right now. So as you can see, I have a huge bump over here, and as you can see I can show my teeth and my lips like really pulling up, and I'm a little bit upset and a bit worried about that, but I guess I can only just wait for the swelling to go down. So my nose from the front is straight, the septum straightened. My nostrils are like the same sort of size. I didn't even get much scarring with the stitches really. Dr. De Silva just said you can put lip makeup and go out and no one can even tell. So yeah, from the side this is how it looks. It's straight, exactly how I wanted it. It doesn't droop anymore. I can't really smile, so I can't tell whether what it looks like, but my tip of the nose is still very swollen, so I'm just waiting for that to sort of go down as time goes. And this is my other side. So I am happy with the result. Dr. De Silva said the only thing to sort of fasten like the process of like the swelling is to make sure that I apply a tape. So yesterday he demonstrated that he provided me with the tape and demonstrated that I need to apply it from here, going around from the nose and back up, and he said to do this for the next 4 to 5 weeks, I think, and this is to just help it help the swelling go down. I think once the cast is off it could start to swell again, so the tape actually helps it. Whilst I'm at home I can do this, and he said to do this overnight. It doesn't really need to be done in the day, which is not too bad, so you can go out and, you know, with a bit of makeup I can just step out the house or whatever. It's not that much of a concern. I did explain that I am getting a watery liquid from my nose, and he says sometimes this could be a sign of a sinus infection, and as I did mention in my previous video, I had a bit of a weird smell, and Dr. De Silva did say yesterday, are you getting weird smells? And I said yeah, I was, in my nose, just a bit of a off odour, and I know it's coming from inside my nose. So he said just to monitor this over the next couple of days. Usually you shouldn't get an infection because you're on a strong dose of antibiotics, so I'm just going to monitor this over the next couple of days and see how it goes. And yeah, nothing much really. I think with my nose, all in all, I'm happy. I think I'm more concerned about my smile. I just want that to come back so I can show my teeth, because right now I can't, and my lip is not lifting up, as you can see, but we'll see how that goes. It's also nice to know that Dr. De Silva, on like today's Saturday, on the weekend, he's taken his time out to speak to me and reassure me that things will get better, and I'm due to follow him up in the next 6 weeks, so maybe he'll give me some more injections then, or seeing how it goes really. And yeah, that's about it really. I'll update you all tomorrow and take you from there. Thanks guys, bye.